So a super common question I get is people wanting to know what is a naturopathic doctor and how is it different from other types of doctors like medical doctors or DOs or even chiropractors or maybe even just a simple like herbalist. There's some slight differences and there's some pretty big differences. To jump into first, let's cover like what's pretty similar or what's almost the same. So a naturopathic doctor, depending on the state, and most states are getting a lot better at declaring what is a naturopathic doctor versus what is somebody that may have a natural medicine certificate. But the main thing is that they both go through 4-year accredited programs, accredited and approved from the Department of Education. So whether it's a medical doctor, an MD, a DO, or an ND, a naturopathic doctor, they're both going through this 4-year-long accredited program. If you dive into the nuts and bolts of it is what each program tends to study. So for a naturopathic doctor, that's one of my degrees. That's what I can speak to the most is we still learn a lot of what conventional medical schools is what they're being termed. A conventional medical school where you become a medical doctor is studying and learning. Pharmaceuticals, physical medicine, surgery, like a minor surgery application. So like suturing, stuff like that. So we do learn a lot of what a medical school is learning. Labs, all the biosciences, biochemistry, all that really fun, cool stuff. And then on top of it, we also get to learn things like herbal medicine, homeopathy, nutrition, a lot of nutrition. It's actually a big complaint I have from a lot of my colleague and MD friends is that they don't get to learn a lot of nutrition. I think they get sometimes one course, even at the Ivy level schools. So probably in the future they're going to be implementing that a lot more into conventional medical school programs. So we get a lot of training in nutrition, even nutritional medicine. Physical medicine, stuff like you think like a chiropractor does, getting adjustments, or it doesn't even have to be that firm of a physical medicine treatment. So we learn a lot more natural remedies, and the philosophy is a little different. So our philosophy is to get to the root cause of the condition, to treat the person as a whole, to treat a little more holistically, and try to start with safer options as opposed to starting only with pharmaceuticals or surgery. So those are a couple big glaring differences between a naturopathic doctor and a medical doctor. A DO kind of synthesizes both of those from what I understand. But I've heard they've become a little bit more conventional. But eventually it's going to narrow down to your doctor and what they're passionate about and what they're going to want to focus on. And you can find plenty of naturopathic doctors that utilize pharmaceuticals. I am one of them. I'm a big proponent of using pharmaceuticals at the right time and place. There's a need for them. And you'll find plenty of medical doctors that really emphasize diet and lifestyle and using more natural remedies to start off with. So really it boils down to the kind of doctor the person that you're seeing. So those are two of the big glaring differences is what we're learning in the college and really the core philosophy, how we're approaching a patient. So I hope that helped summarize any differences. Basically, go find a doctor, talk to them, get a good vibe from them, and make sure they're a good fit for you. Because there's not really any bad type of medicine. We're all trying to help people. We're all trying, ideally, hopefully, everyone's in this for the same reason, and that's to help people. So hopefully that helped. If you have any questions or comments, leave them down in the comment section below, and hopefully we can get to them in another fun video. This is Dr. Travis Whitney with the Healthcare Institute, and I'll see you in the next video.